One Easter Sunday, I taught an 11-year-old boy to successfully tube feed a litter of beagle puppies. If he could do it, so can you. The following instructions and supplies will allow you to be a confident and successful tube feeding person. Hi, I'm Dr. Marty Greer from Revival Animal Health. When it comes to tube feeding, first you need to get together your materials. Commercial milk replacer, such as Breeder's Edge Foster Care, a feeding tube, silicone or red rubber, I prefer the silicone clear, an 8 to a 14 French based on the size of the puppy, a rectal thermometer along with Vaseline to make sure the puppy is warm enough, a permanent magic marker to mark the tube so that you get the appropriate length passed into the puppy, and then a syringe of an appropriate size between 10 and 60 cc's that fits the feeding tube, and along with that a puppy scale to weigh in both ounces and grams. Once you have these supplies, you can begin the process of tube feeding. Since puppies can only be tube fed during the first few hours of life, we're going to show you how tube feeding is done with this stuffed animal, diagrams, and a video I've taken of tube feeding being done. Establish a well-lit, warm location where you can hold the puppy comfortably and all materials are within reach. Be attentive and do not rush. Take the puppy's temperature rectally. Do not feed unless the rectal temperature is between 96 and 99 degrees Fahrenheit. If the puppy's temperature is below 96 degrees, slowly warm the puppy to 96 degrees before feeding. On a safe surface, hold the puppy with the neck extended. Hold the tapered end of the feeding tube, even with the last rib of the puppy, to the tip of the puppy's nose. At this point, you'll want to mark the feeding tube with a marker or piece of tape. In this way, you'll be assured that the right length of tube is going to be passed into the puppy. Next, you're going to fill your syringe with the formula, the calculated amount. I use 1 cc per 1 ounce of body weight. So a 4-ounce puppy gets 4 cc's plus 1 cc of air. You want to warm the formula in a water bath. Avoid microwaving the formula. Next, attach the syringe to the end of the tube. Have this done before you pass the tube. With you and the puppy fully awake and warm, the puppy should be over 96 degrees and the puppy lying horizontally on its chest. You want to gently pass the tube on the left side of the center of the puppy's tongue, applying gentle pressure to slide the tube up to the mark. There's a couple tricks to this to make sure you're in the right place. First, you want to keep the puppy's chin down. The temptation is to tip the puppy's head up, and in doing so, you're going to be likely to open up the airway and more likely to pass the tube into the wrong place. So you pass with the chin down, pass with the tube to the left, and then you pass until you get to the mark where the puppy's nose met the last rib. If resistance is met, remove the tube and start over. With your left hand, if you are right-handed, cup your left hand around the back of the puppy's head and hold the tube between your index and middle finger to prevent it from moving out of the correct position while you are feeding. Reverse this if you're left-handed. Before feeding, firmly pinch the puppy on the foot or the tail. If you can feel or hear the puppy vocalizing, the tube placement is correct, and you can proceed with tube feeding. If the tube is mistakenly in the trachea, the puppy will struggle but not be able to make any sound. At that point, stop immediately, remove the tube, and start the process over. With your right hand, depress the plunger of the syringe, not too quickly, delivering the calculated amount, stopping sooner should milk reflux out of the puppy's nose or mouth. At the point that you're done feeding, you want to flex the tube on itself, just kink it, and pull it out to make sure that the puppy doesn't aspirate any formula as you're pulling the tube. Repeat for each puppy. Before you feed the next time, wash the syringe and tube with hot soapy water, allow to air dry before the next feeding, and then at the conclusion of feeding, you want to stimulate the puppy's anal and urinary orifices to help with defecation and urination with a warm, moistened cotton ball or washcloth. So just remember to follow the 6 P's of successful tube feeding. If you follow these 6 guidelines, you too can be successful in raising puppies who are off to a rough start in life. 1. Pre-measure the tube from the tip of the nose to the last rib and mark the tube. 2. Pre-warm the puppy in the formula. 3. Pass with the chin down. 4. Pass down the side, preferably to the left. 5th, pinch and hear the vocalization prior to feeding. And 6th, place the tube in a bowl of water at the end of the tube with the syringe off and see if bubbles come out. That's just in case you're worried that you're still in the airway. I personally don't do this, but it can be reassuring at 2 o'clock in the morning and you're not quite sure when you're all alone. So fear not, you will lose more puppies to starvation than to an error in tube feeding.
Hi, if you're watching on YouTube, consider subscribing to the Revival Animal Health YouTube channel. If you have a pet health question, call our pet care pros at this number. And don't miss our other pet health videos.